All right, so now we're going to get into the reproductive system terminology. So, the reproductive system is the main system where we will see large anatomical differences between female. And again, that is directly down to the actual function or physiology behind reproductive ability. So, a few things to talk about. The primary female sex organ is the actual ovary. Everything else is considered a secondary sex organ, and it exists to essentially perform the ovary and the ovum's function. Okay. Going through it, you have the vagina here. There's going to be essentially opening to the uterus called the cervix. Helps to essentially strictly control the entryway of sperm at the uterus. The uterus is obviously the site of development. Ovum will essentially be, don't want to say pulled, but pushed / pulled out of the ovary through the uterine or the fallopian tubes, it's called ovarian tubes, make their way down to the uterus. And if there is enough sperm present, there can be the process of fertilization, followed shortly thereafter, about a week later, of implantation into the. So looking here, we've removed essentially all the excess non-reproductive anatomy. When we look at the uterus itself, uterus, kind of like the heart, has several layers to it. The innermost layer, which actually functions to nourish ovum or the egg, is the endometrium. Endometrium is actually made up of 2 layers itself, and that's how we get the uterine cycle to progress. Essentially, one layer goes through a process where it essentially falls off, and then the basal layer undergoes a lot of reproduction to replace that layer that has. So with the male urinary system, as you'll see, a large portion of it is external of the body. Part of this is because the primary sex organ is actually testes, and for the biochemical processes that occur to actually create sperm, the testes actually needs to be a few degrees cooler than the internal body temperature. It allows the proper and more efficient creation of sperm itself. So remember, the primary sex organs in a male is the testes, whereas female, it's an ovary. These 2 organs are homologous to each other. Everything else is secondary and exists literally to provide an ability for the sperm and the egg to meet. What we have here with the sperm gets produced in the testes, undergoes a couple different processes. It travels through the epididymis. Epididymis, again, plays another role, and it kind of is a storage container as well. It will then enter the vas deferens, sometimes ductus deferens, where it then wraps around the bladder, posterior side of the bladder, and goes to what's called, well, doesn't exactly go to the seminal vesicle, but it's going to meet up with the seminal vesicle ducts, as well as go through the prostate. At this point, you get all of the different materials added to the sperm, and those materials pretty much do one of 2 things. They are going to, one, help lubricate the surfaces that the sperm will travel through, but they also exist to provide nutrients to the sperm itself. And this is a reason why sperm is technically viable up to 72 hours outside of the epididymis or the testes. So it goes through here, and then it's going to join up with the urethra. And from the urinary discussion, you'll notice this is one of the main differences in the urinary system between males and females is the urethra. In males, we actually talk about the urethra as three very different components. We're going to have essentially prostatic urethra, and for the purpose of our discussion, we have spongy or penile. So, one of the common things we've seen people do is pronounce prostate with an extra R, like prostrate. Very different. Another thing to note as well, while a lot of the embryologically in development, the male and female systems tend to have a lot of this organ is equivalent to this organ. Well, there's one exception to that rule, and that is the prostate. There is no embryological tissue in the female that is equivalent to it serves a function that doesn't have to exist in. So again, talked about some of this already, but essentially two main functions of the reproductive system, and that's the main function is literally to reproduce and create offspring. But there's two parts to that. It's to produce an egg and sperm. Part of that function is going to involve hormones, a lot more important in the female side of things. But it also is to have anatomy that helps all of this happen. So combining forms, cervico is cervix. We talk about cervic. You'll see that term used like in cervical spine, cervical vertebrae. It actually relates to neck, and the cervix and the vagina are a very narrowed area, kind of like a neck. Pulpo or vagino is vagina. Endometrio specifically refers to the inner layer of the uterus called the endometrium. We can also talk about something like myometrium. About if you think back to the CV system, at endocardium, at the myocardium. So myometrium would be the muscular layer of gyneco refers to woman. Hystero refers to the uterus itself. Mammo or mast refers to breast. Minnow refers to menstruation. Ophoro refers to ovary itself. Salpingo refers to the uterine tube. Orchio refers to the testes. Prostato, prostate. Scroto, scrotum. Vaso is vessel or duct, like the vas deferens. Seal, a hernia or a protrusion. Hexi, we talked about this already before, surgical fixation. Ptosis, or ptosis, actually. It's ptosis. Is a drooping, sagging, or a prolapse. We can talk about ptosis in elderly populations where their eyelid will actually sag down and actually not uncover their eye. Raphe, again, suturing or repairing. Rhexis is a rupture. Through here, female reproductive system, amenorrhea is essentially the lack of menstruation. Cervicectomies, removal of the cervix. Cervicitis, colpoptosis, colposcope, colposcopy. Cystocele. Dysmenorrhea is just another term for the dysfunction of the menstrual cycle. Through here, endometrial. Endometriosis is a condition involving several different things. It's a very, very painful condition. gynecologist. Gynecology, again, referring to the study and the specialists that perform gynecological procedure. Hysterectomy, removal of uterus, hysteropexy. It's a fixation. We saw this with kidneys as well. For various reasons, you can kind of get things moving around in ways that they shouldn't, and you can fixate them to the wall, to other nearby tissues, so they stop moving. Again, more terms through here. Menorrhagia and menorrhea, again referring to the cycle. Oophorectomy, this is removal of the ovary. Oophoreitis is an inflammation or infection of the ovary. Same thing can happen with the ovary, where it needs to be fixated to the abdominal wall. Ovaries actually, I don't want to say loosely attached, but it doesn't have as strong of an attachment to the abdominal wall as other organs do. So what do we see here? This is a protrusion of the bladder through the vaginal wall. So a cystocele. Remember, back from the urinary system, we refer to conditions with the bladder as with the root cyst. Prolapse of the uterus is a hysterotosis, with, again, the P being silent. So what we have here is essentially more procedures being done. So radiographic image of the uterus and uterine tubes. Radiographic images are grams. Okay, the uterus is hystero and uterine tube is salpingo, so we have a hystero-salpingogram. A hysterectomy is literally the removal of. Again, we're showing the oophorectomy, removal of the ovary. And we can also have a hysterosalpingo oophorectomy, which is a removal of essentially everything above the vagina. What you see here, again, is a mammogram, basically, looking for potentially any dysfunctional growth in breast tissue. Again, more conditions. Talk about inflammation of the endometrium, endometritis. Inflammation of the cervix is cervicitis. Inflammation of the vagina is vaginitis. Inflammation of the uterine tube, this is salpingitis. A point to highlight is all of these collectively fall under the umbrella of pelvic inflammatory disease, or PID. Moving on to the male reproductive system, again, remember, orchi refers to the testes, prost refers to the prostate. You can have scrotocele. That's, again, essentially a hernia into the scrotum. You're looking here, prostatic cancer, very dangerous condition. A vasectomy. So vasectomies are essentially where a portion of the vas deferens gets removed, and at that point, sperm will no longer exit the penis. So words not built from word parts. Dilation. This is referring to birth diameter that the cervix is expanding to. Pap smear, pelvic inflammatory disease, already talked about, and a uterine fibroid. So uterine fibroids are literally just a fibrous growth that grows on or inside of the uterus wall. What we see here with males, a benign prostatic hyperplasia, or BPH, very common condition in older men, and that's why prostate exam, I believe 45 years of age is just doing them yearly. Circumcision is removal of foreskin. Digital rectal examination, that'll be done to examine the prostate, because the prostate literally sits on the anterior wall of the colon. There can also be a transurethral resection of the prostate gland. So basically, you can perform a surgery through the urethra to resect or remove parts of the prostate gland.